COVID-19 is disrupting our lives in so many ways, from business closures to social distancing, being stuck inside your home. How is this impacting our mental health, though? We are joined by Dr. Craig Sawchuk from the Mayo Clinic. Good morning, and thank you so much for joining us.
Thank you, and our thoughts are with everybody out there on the West Coast.
Well, we're so grateful you're talking to us. Can you begin with telling us about some ways to cope with the feelings of social isolation and our abrupt changes to our daily routine?
Right, we're seeing a tremendous amount of uncertainty, and you certainly don't need a psychologist to point that out to everybody. But there's really three things that we keep in mind for helping people to cope with this stress. One is just maintaining those normal daily routines. Get up at a routine time, shower, get dressed, go to bed at the same time, keeping the nutrition going. Secondly, we think of making sure that you're filling the tank. This is a really stressful time. So getting things done like exercise, doing relaxation, focusing on projects, ways of being productive. And the brain likes novelty, so maybe even learning some new things while you're at home. And then we also want to think about staying socially connected, but functionally disconnected at the same time. So we have to make sure that we're respecting everybody's distance right now and staying connected with the people that we love, that we're close to, maybe using video visits, phone and texting, but also making sure that we're setting limits on the amount of media that we're taking in as well.
And how about for folks who may have lost their jobs, or maybe they don't know if they might be laid off? There's so much uncertainty right now for families.
Yeah, there really is a tremendous amount of uncertainty right now, and I think that's where we want to make sure that we're really compassionate and empathetic with what's going on with folks. Keep in mind, we actually don't know how this is going to turn out in the end or how long this is going to take. But do know that there are a lot of people that are working on this right now and trying to get this to a better place. It may take some time and uncertainty, but maintain some of that faith and optimism as well, too.
And how do we know the difference between being just stressed out, nervous, feeling cabin fever, and then it being more serious, that where it needs to be treated, anxiety or depression?
Right. And certainly what we're seeing right now, what people are going through, may not necessarily be what we're going to be seeing down the line as well, too. So being stressed right now, being on, worrying, even some sleep disruption, some irritability is actually fairly normal. But at some point, it really does cross the line in terms of where it starts to interfere a lot with our day-to-day activities, with our abilities to problem solve, when people are almost slowing down and shutting down too much, when they're having, say, too much worry, rumination, panic. That might be a good time to be able to reach out and get some help.
And where should people reach out? When we're stuck at home, do you call your doctor? Do you call a hospital? I know there's a lot of telemedicine happening as well.
Right, and this is where, you know, when we're dealing with difficult situations, innovations do happen. So we really do see a lot of our clinics around the country really doing innovative things to reach out to patients and to make sure that they're connected with care. There's also a great website, the Anxiety and Depression Association of America, so adaa.org. They have excellent resources regarding dealing with the COVID-19 virus, the anxiety and the stress that goes along with that, but also ways to help get connected people with resources.
Oh, great. So ADAA, thank you so much, Dr. Sawchuk. Really feel better just talking to you.